Welcome back to Good Things Utah. Talking now about buccal fat, also known as cheek fat, on the show today with Dr. Douglas Henstrom from Utah Facial Plastics in this sponsored interview. It is good to see you.
It's awesome to be back, and it's my pleasure to be here on International Women's Day.
Thank you for joining us. I love this. You work with a lot of women I know in your office,
Yes,
a lot
we
of
do.
incredible women every single day.
Phenomenal women that work there, phenomenal female patients that we get to see all the time.
I just came in 2 days ago. It is so gorgeous. If you've not been to the Draper location, you must go check it out. Okay, buccal fat.
Yeah.
Where is that?
Okay, so your face is comprised of multiple fat compartments, both superficial as well as deep. Your buccal fat is going to be one of the deeper fat compartments between your cheekbone and your jawbone. Sits right here. As we age, it's one of the big things that contributes to some jowling that we get.
So it drops down?
It can, yeah. It can.
Okay, so it settles. We're looking at pictures on our screen, Dr. Henstrom. Is that it right off to the side of the mouth and the chin?
So you see that upper picture and you see that jowling you get. A contribution of that jowling is from that buccal fat that's underneath there. Now, a couple unique things about the buccal fat is it doesn't change with weight loss or weight gain. It's pretty stable throughout the course of your life, but gravity can pull it down. This picture shows a before and after of one of the more common reasons that will actually remove buccal fat, and that's in the setting of a patient who's getting a facelift. This is contributing to that jowling, that aged face appearance. So when we do a facelift, it's not uncommon for us to take out some of that buccal fat to reduce the jowling and get some of that volume out of there to help with the lift.
So it's called buccal fat removal.
Yep.
That's the name of the procedure, and it typically accompanies a facelift, or can you do that on its own?
We can do it on its own, but here's the thing. We wanted to get ahead of this because this has become a pretty popular topic and a kind of a trend in the cosmetic world because some pretty famous people have done this. Chrissy Teigen comes to mind. She's actually spoke about it. A lot of other people don't speak about it, but you look at some before and afters and you see that they're taking the buccal fat out of their cheeks to try to give themselves a more hollowed experience or a more hollowed look and accentuate cheekbones, accentuate the jawbone. And so it's been happening more and more. So there is an office procedure that can be done intraorally through the mouth to just try to take out some of the buccal fat, but it's not for everybody.
Who's it for? Like, who would be a candidate for that?
Well, you don't want to do it if you already have a lot of lax skin, because you got to do something to tighten the skin with it, or else it will accentuate that.
Oh,
okay?
This is true. Once you remove that,
it's going to hollow out. And if you think about this, we have so many more patients that come see us that want volume in the face. They come to see us for fillers. They come to see us for fat injections because they want volume in the face, because that's associated with more of a youthful look. Now we've got this trend of taking some out to accentuate bony structures. If done right, if done conservatively, it can do that. And it's for the patients or for the people who have a really round, full face. They don't necessarily like that full round face look, and you take out some just to give them a little bit more accentuation of the bony structures, but it can certainly be overdone, and you've got to be careful, and you got to know that you're doing things right.
Chrissy Teigen in her 30s, right?
Yeah.
What's the typical age of someone that comes in to do this?
Well, we're seeing people both at the older age spectrum where we're mainly bringing it up with them because they're here to see us for facelifts, and then you've got the younger patients who are coming in. They still have a round face. And that's okay. That's not a bad look by any means, but they have a round face. They don't like all the volume in the face, so they're coming and asking us about that. So yeah, patients in their 20s and 30s, it's not uncommon to see them for this.
I would like to borrow some of your buccal fat if anyone has any, because that would not be something that I have more of the hollowing.
Yeah.
Every face is different.
And it is, and you've got to be careful because this is a permanent change. Okay, it is a trend that's happening, but if you go through the procedure, it's a permanent change. You're not going to get that back. And we've seen some patients, this is something that's been around for a long time. People have been doing this, but now it's becoming a hot trend. But we see patients who have had it done years ago who are coming back to us and complaining of it being too hollow and asking us to put filler or fat in their face to give them volume again, because that hollowed out, too gaunt of a look ages you. So there's a real balance. It's incredibly important that you get with a professional like us. We try to be the Utah's facial experts and talk with us about the pros and cons of any procedure that involves your face, especially procedures like this where it's going to be long lasting, you can't reverse it.
Yeah, make sure you get a consultation, everybody, from the experts. Utah Facial Plastics. They're in Layton, they're in Draper, and their website is on your screen. If you're thinking about an appointment, make sure you get in soon because they are busy. They're incredible over there. Information on our website, and our thanks to Utah Facial Plastics for this sponsored interview. Good to see you, Dr. Henstrom.
Hey, it's my pleasure being here. Thanks for having us.